Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is President of Central Care and Radiation Oncologist, Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have independent state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, maybe access to clinical trials, financial counseling, or other supportive services for yourself or your family, even genetic screenings for cancers, Central Care is here for you. At any time, feel free to email with any questions or comments. AskDoctor@cccancer.com. That's AskDoctor@cccancer.com. Our discussion today centers around cervical cancer. January is Cervical Cancer Awareness Month. So, Doctor, I'll bring you in here. I thought maybe we would first talk about what a pelvic exam entails.
Thank you, Leanne. And I want to make sure that we emphasize the fact that we work with all kinds of clinics and throughout Kansas and Missouri. We may have patients that go to the university or HCA or St. Luke's or Topeka, and many times they get procedures or specialized services in those regions, but can get the rest of their treatment or the main treatment near home, which really affords a lot of convenience and less stress. In cancer of the cervix, the first step is to do the pelvic exam, and the pelvic exam is something that should be done yearly. Now, it can be with your primary care physician, it could be with a gynecologist, but it has to be done in what I call in earnest, meaningfully. What does that mean? It means that we need to consider the parts of the female anatomy. That includes the outside, the skin. It includes the vaginal area. It includes the cervix itself, which is a little donut-like structure. Let's say if you could imagine a vase, which is the opening of the vase, the beginning of the bottle right there, that's the cervix, which has a different lining than the uterus itself. And then imagine a bat hanging upside down with the head being the cervix. The body is the uterus, and the wings are the perimetria. Now, these things are examined in a way that is different. Not doing an exam with a digital exam, meaning putting your finger in the vagina, and that's all, does not evaluate all of these structures together. You have to actually first do a visual exam, meaning do you have unusual or abnormal spots or thickenings in your skin, which it does help, and I do tell my ladies, especially the redheads, that the less hair in that area, so I can really look, the better. And then you have the vaginal area, which is not a tube. You know, some people think that somehow the vagina is this rigid tube that you can just look at and, wow, you can see everything. That's not what happens. The tissues actually fall upon themselves. As you open up, you get to see the tissues as they are being spread by the speculum, which is that rigid structure that we use to look. And then you find that the very top, the cervix, and that's what you can do with a visual exam. If you cannot see the cervix, which is sometimes hard because we are not all built the same. The length of the vagina varies, and sometimes the speculum is not made, even though we only have, in many clinics, they only have one size, and it does not fit all. Sometimes the woman has a very long torso, and likewise a very long vagina. Sometimes the woman has something called the cystocele or rectocele, meaning that there is a pocket of the bladder or the rectum that goes into the vagina, which makes it impossible to see the cervix unless you have the proper equipment. So when you get a pap smear, I have a lady right now, in fact, that's had a pap smear every single year for the last 5 years and now has a huge cancer and doesn't understand why.
Oh, boy.
Well, it's because they never really got to the cervix. The cervix was hard to see in this lady, even with special equipment. So doing pap smears on the vaginal tissue does not give you the answer of the pap smear is only and exclusively for the cervix. The cervix is covered with a squamous epithelium. In other words, the covering is made of these cells that are squashed or squamous. Then they go into the womb, which is a muscle that is lined by a gland-like lining, which can give you a different type of cancer, actually more common than cervical cancer in older women. And then the bat-like projections that actually attach to your pelvis and sacrum so that the uterus is in place. These structures are particularly made so when a woman gets pregnant, they hold the uterus in place, and they're able to give you the ability to hold your bowels and everything in place, and you're able to have normal functions of that area. So when you do a pap smear, it only will tell you things that are happening in the cervix if you see the cervix. If you do a pap smear of the tissue or of the vaginal tissue, it will tell you nothing. So if you have a cancer of the uterus, it will probably not show up on a pap smear, even if the pap smear is done correctly. So you have to start with a pelvic exam. Now, if you do not have a rectal exam along with a vaginal exam together, you will not feel the uterus, the ovaries, and the perimetria. So the wings of the bat are like the tubes leading to the ovaries that are held by these tissues, these bat wings, that connect them to your pelvic side walls, and you're able to hold up your uterus and the rest of your structures. Please, ladies, listen to me. If you do not get a rectal exam, you will not have the ovaries or uterus evaluated. And especially if you're older, like if you're over 40 years of age, the ability to feel your uterus is very important because a pap smear will not tell you anything about your uterus. It is the rectal exam that will tell you something about your uterus. So once we have done a good pelvic exam and we see that the pap smear is abnormal, that's when we begin to start the workup for a cervical cancer.
Cervical cancer, is it mostly diagnosed with women that are older, or is it younger as well, or?
No, actually, cervical cancer is being seen as young as 15 years of age.
Oh, wow.
And that's because it is almost 100% due to human papillomavirus, HPV. So what happens is as soon as you are sexually active, you get exposed to a sexual partner. So if you have 3 sexual partners, you have 400 exposures because of the exponential exposure of each of these partners to other partners in themselves. So you're bringing to your body the possibility of this virus. And there are about 15 to 18 cancer-producing human papillomavirus strains. Some of them, 4 of them, are particularly virulent, and they always produce cancer. It takes a while, though, to see a cancer. You first see something called dysplasia, or that the cells of your cervix are angry. They are dysplastic, meaning that they're not normal, they're irritated. And that's when you begin to see that something isn't right.
Is there a symptom or anything that you would experience for cervical?
No, unfortunately not. Actually, with cancer, yes. You may have fragility of tissue, meaning that you have some bleeding that is more excessive between periods or with intercourse, or actually pain with intercourse. We call that dyspareunia. So if you have bleeding, we call it post-coital bleeding, then we need to have somebody see you because the likelihood of you having cancer is high. And actually, when you have an early cancer of the cervix, it's almost 100% survival incurability with a simple surgery. And especially if you have cancer in situ, meaning cancer that is not yet invaded, but just in there. It begins to be a problem if it becomes bulky or if it becomes spread onto the wings, these bat wings I was talking about the perimetria. Then we're beginning to see where radiation and chemotherapy are your only chance of cure. But the cure, if you're done right, is actually quite good. I have to knock on wood here, even with stage 3 cancers, I have 100% survival, which is because I take great care in making sure that everything is covered correctly and that we do the 3 parts of the treatment, which is the chemoradiation. That's the 2 parts. And then we do the brachytherapy, meaning that we insert a special apparatus inside. And just like anything, it's actually not, it's very treatment, the treating person is the one basically driving the bus. So you are going to get to a good result if we are able to do this in the correct order and manner.
Again, I'm with radiation oncologist and president of Central Care, Dr. Perez-Tamayo, and we've been talking about cervical cancer as January is Cervical Cancer Awareness Month. Doctor, when it comes to HPV, why don't you I know you touched on it a little bit here, but there are many different kinds of HPV, but not all of them, though, cause cancer, correct?
That's right. Not every HPV, human papillomavirus, is within our bodies. It's something that we have, everybody has, and there are certain types that are more commonly provoking cancer. In fact, those are the quadrivalent, which means four types that are being done as vaccinations that are being covered because they are the ones that cause 80% of the cancers. So if you are not sexually active yet, and in fact, now they go up to about 40 years of age, you can get the vaccination and reduce your chances of having cancer of the cervix and other places by 80%. And why do I say other places? Is that papillomavirus attacks the basal layer. And what does that mean? It means below the surface. And it makes your normal cells start going berserk. And then they start growing out of control. So this is what causes the cancer. So any lining, meaning the lining of your cervix, the lining of your bladder, esophagus, and your mouth in particular, your anal area, all of these can then become a target for this human papillomavirus. In fact, once you have cancer of the cervix, you have to understand that your partners are also at risk for having cancer of the penis, of the head, neck, even of the fingernail. So any lining at all can become contaminated by this virus, and then you have a cancer. But these are highly curable. Please listen to this because even when they are at advanced, meaning that they are involving lymph nodes, the curability is very high because they do respond well to the treatments we have. So letting it go is not a good idea since you can easily get rid of these cancers and have a cure rate that is over 80%.
Do you have to have sex in order for that virus to spread?
Yes, it is a sexually transmitted disease, although we don't know everything about it. I have said this before, and again, it's just my hypothesis. Men have a higher incidence of head and neck HPV-related cancers of the head and neck area, meaning of the tonsil, of the base of tongue. And yet the studies show that more women are the ones that are involved in oral sex rather than the men, yet they have less risk of head and neck cancers due to HPV. So why are men having higher HPV-related cancers? And my idea is that this virus can be propagated through, contamination. And so you may not, realize that by not washing your hands after urinating, for instance, you may be putting it in your mouth or other places accidentally. So it is a good policy, and especially in these days of COVID, to wash your hands often.
Yeah, please, definitely. Symptoms to having the HPV virus, is there any, necessarily?
Usually when you have the dysplasia and the friability of tissue, because what the dysplasia does, it's like a wart. So if you can imagine a wart on your finger, if you push it, it begins to bleed. So what happens in those tissues, and you have a sexual intercourse, you may have this starting to bleed easily, and so you have different things that happen to you, whether it's your period, a tampon, sexual intercourse, that you begin to have an unusual period, unusual bleeding, or even pain. And that's usually when we have the person presenting to the doctor. But, it shouldn't be that way. You can actually see these very early on if you just get your pap smear. And it's not expensive. I know that unfortunately, the recommendations that have been given about doing your pap smear every 5 years and every 10 years for certain age groups is what is being touted as the right thing to do. But frankly speaking, if you have, it's not very costly. If you have the ability to just go ahead and have it done, and especially if you're at risk, that means if you have more than one sexual partner or your partner has had many, many partners, you should really request it, even if you have to pay for it yourself.
What does the HPV test involve? Is it just a blood test then, I assume?
No, actually, the grading is right there. They can grade the type of HPV that you have, if you have HPV, and they can tell you if these are, especially if you have venereal warts, they can do that, and that should be covered. But it's not something that is done often. It can be done. And it's not necessarily something that will give you the assurance that you're off the hook. It is actually the dysplasia, or in some cases even before dysplasia, it's called koilocytosis, meaning that you begin to see that the cells are being infected by a virus, and you see that on the Pap smear. And request your results, look at them, read them. Koilocytosis means these cells have viruses in them, and maybe then you can request the grading or seeing if you have HPV. Now, this is why we're here. If you have a question about your Pap smear, even if you do not have cancer, we're here to answer your questions and your concerns so that we can lead you into, either assurances or a specialty consultation if it's necessary. Don't leave this to chance, and don't let it grow to be something that becomes unwieldy.
Some people might feel just a little, maybe even embarrassed, ashamed, to want to even talk about cervical cancer or their results, with anybody. But that's definitely not the case, especially when it's the survival rate is just so high if you catch it early enough.
That's right, Leanne. And human papillomavirus has been with us for centuries. It just happens to be some of the types are more malignant. It's like the coronavirus. Coronaviruses are everywhere, and they have been with us for a long time. But now we have different variants that cause us more destruction. These happen to be variants that cause us cancer. So there's no shame in it, and it's easy to just get the question answered.
Yes, exactly. I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center, and we've been covering cervical cancer today. But Dr. Perez-Tamayo, let's talk a little bit more about the HPV vaccination, the preventive measures to HPV. What is the basics, of course, is to get the vaccination, correct?
That's right. Preventive measures include, of course, being very conscious and diligent about your sexual partners, and also using condoms. If you have the protection of a barrier like a condom, you're less likely to get HPV. And I say less likely because there are skin contact. You may not have it in the cervix, but you have it in the vulva. You can have cancer of HPV related in the vulva and clitoris. So again, the condom only protects your cervix and vaginal area. But then you have getting your vaccination can prevent 80% of the chance of getting it anywhere. And in the U.S., Gardasil 9 is designed to protect from the 9 strains that potentially will give you the HPV-related cancers. The FDA showed that the vaccine was very effective in reducing HPV infections leading to cancer, and that includes, all cancers, including the head, neck, the cervical cancer, and anywhere else. There's other vaccinations around, including Cervivix and the Gardasil in addition, that is less than 9. And in fact, they've lowered the ages to receive it from, what it used to be 15, and now it's 9 to 12, young adults, even 13 through 26. And both men and women should get it. Before it used to be only women, which, here again, the 2 main HPV strains that cause cancer is the HPV 16 and 18, but there are, there's more than 9, but 9 are the ones that cause 80% of cancer, so that's what is being covered. You can get the vaccination even if you're sexually active. It is preferable that you get the vaccination before you're sexually active, and that's why they have lowered the age to even 9. Now, there is a little bit of a corollary And this kind of hurts me a bit. Many are resistant to getting the vaccination because somehow it is a under the table acknowledgement that, number one, your children that are that young could become sexually active, or that somehow you are permitting them to become sexually active. And that is absolutely not the case. It's just like any vaccination. You would not consider polio vaccination a shameful thing to do. Likewise, this is something that you can prevent your child from becoming, a victim of cancer and leaving their children, if they have children, being orphans. So don't forget that this is a very painful cancer and one that can be completely eradicated if you just are, thinking about vaccinating. You can also be vaccinating yourself if you're even up to 40. It's less effective because you've been exposed much more.
I have a question for you, too. When it comes to the treatment of cervical cancer, you had mentioned beforehand, doing combination of chemotherapy, radiation therapy, and then brachytherapy. Is that pretty much the common standard when it comes to the treatment?
Usually it all depends on the stage and how aggressive the surgeon is to doing the surgery. It's always a game of it's a balance of what you can gain by surgery versus what things you're not covering with surgery. So if you have a very small cancer and it hasn't gone anywhere, to remove the uterus, tubes and ovaries, and the perimetria is not something that is extremely problematic because, you do lose the possibility of having children with that, of course, and that goes for any treatment for cancer of the cervix. But it is a one-stop shop. You come in, you get treated, and now that we have robotic surgeries, and not everybody does them, and not everybody feels that they are appropriate for cancer of the cervix. So here again, you need to check with your surgeon. But whatever it is, even an open procedure, it is something you can get over pretty quickly. If it goes to be larger, even if it's just in the cervix itself, then you cannot get rid of the roots, and that's the problem. They're the bat wings. The bat wings are the problem. The surgery cannot remove them. To have surgery will not give you 1 day of advantage. So when you start getting into higher stages, the actual survival is just as high as even stage 1. But you have to cover more areas.
That's what I was just going to ask you, too, is about that. Like if you had a hysterectomy, I mean, of course, then you just essentially eliminate, everything. But is there a chance that the cancer could come back?
Yes, especially if it's gone beyond what you thought. I have often cases of women that they thought were stage 1 cancers, but, unsuspected, but nonetheless they are more. There's positive margins. The cervix was not the only place where this cancer is, and we have to treat them postoperatively. It is not as good as having the case of a woman that has not had surgery. You will do better if you do not have surgery, if we know that the cancer is further along. But that doesn't mean that you can't be salvaged. Salvaged radiation chemotherapy can be used in women that have surgery. Or, sometimes this happens because they start bleeding, and people think it's due to a uterine problem and not a cervical problem, and there is a cancer of the cervix that they did not suspect. The type of surgery you do for cancer is different than a type of cancer you do for something benign. So if they do not do a cancer surgery, meaning that you try to remove the bat wings and also the ovaries, tubes, and also the lymph nodes, then because you didn't know that they had cancer, then you have to go back and treat these remaining organs or remaining parts. The bat wings are very interesting because they're kind of like rubber bands. So if you cut a rubber band, they just kind of spring into the pelvis, and a surgeon can't go back and try to find those pieces of rubber band. These perimetrial supporting structures go back to where they were. That includes the groin, it includes the sacrum, it includes the pelvis, it includes the bone. There's just no way of finding that needle in a haystack.
That's so interesting. So in conclusion, when it comes to, in order to prevent cervical precancers, it's important to have, of course, your screening test, do your pap smear, do the HPV vaccination. If precancer is found, it can be treated, keeping it, of course, from turning into cervical cancer. But ways to prevent HPV: limit your sex partners. Yeah, the vaccination, avoid sex with people who've had maybe many other sex partners. And of course, HPV, you might have it for years, but you just never really know because there's really no symptoms, right?
Exactly. In fact, there are many people that come to me that have cancer of the cervix that feel maybe that their partner has been roaming around, has been unfaithful, and not indeed. It has nothing even to do with their partner. They've had a partner in their past, and it could have been as a teenager or as a young adult, and now it's become into play. In fact, we are now learning more and more about viruses here. The latest news in the coronavirus coming from South Africa is that it's being incubated in people that are debilitated, like the HPV women that maybe are not completely treated with HPV, and so these viruses get a hold of these victims, these hosts that are debilitated, and they then start reproducing. So these HPV sometimes are they take advantage of the host that is debilitated, and then all of a sudden they come into play. What do I mean by that? Well, maybe you get sick. Maybe you all of a sudden have pneumonia, and then the virus that is already there in your body starts taking advantage of your tissue. That's why being healthy, not smoking, and maybe not having issues that are comorbid, in other words, other issues that are giving you basically distractions of your body taking care of itself, then the virus, you're checking the virus yourself. You're keeping it from becoming a problem.
Despite the benefits of cervical cancer screening, not all American women are getting screened, especially I would assume here, even in Kansas, because, most cervical cancer is found in women who have never had a pap test or who have not just maybe have had one recently. They don't have health insurance, and so they just don't go. But there is a program here in Kansas, the Early Detection Works program, and that does help women get breast and cervical cancer screenings in Kansas. And if you are eligible, what they'll do is they'll give you a phone number that you can call. Then they'll just ask you a series of questions to see if you qualify, and then they'll put you in touch then with the closest clinic so that you can get screened for cervical cancer. They also do mammograms, the pelvic exam, the pap test, the HPV test. So the phone number to call is 877-277-1368, 877-277-1368. And it's just a program specifically, like I said, for those that might be qualifying, that are a certain age, do not have health insurance, and you meet the income eligibility guidelines. And it's Early Detection Works program here in Kansas. So I just wanted to make a mention of that.
One of the things I just want to bring up, Leanne, is that we often have a fair in different places here in Kansas. In Wichita, we have a women's fair, and we usually bring our cervical model, which shows the different phases of cervix, and you can actually feel it yourself. Because some women are flexible enough, and not all of us are that flexible, but can feel it yourself. You can actually feel that something isn't right because it's not smooth. It feels gritty, and you will be able to see this in this model. You'll be able to put a finger inside this model and say, oh, I see that this is not normal. So come and visit with us. Stay tuned to when we have our fair, and we will be able to show you what you can do for yourself.
That is a great point, because there's been several women that have done that. They're like, I never knew that you could actually do it yourself, but then also, what to expect for it to feel like. But like you said, gritty. Is there anything else you want to add about cervical cancer?
No, just that if you have any concerns, you can just call us and ask questions. It is free of charge, and we can guide you to the right place.
That's right. Thank you so much, Dr. Perez-Tamayo. We appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With independent facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care all under one roof, so there's no need to travel far for the best care. Whether you need radiation or chemotherapy, maybe a second opinion, access to clinical trials, financial counseling, or even supportive services for yourself or your family, Central Care is here for you. You have a choice. Bringing that expert care to you is an important component in the success of your outcome. Being surrounded by your family, your friends, that can be the factor that elevates your treatment. Feel free to reach out to our offices calling 800-592-5110, or you can visit us online, cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.